Alcohol Abuse During the COVID-19 Pandemic by Samantha Gonzalez. The virus has helped fuel a disease. Alcohol abuse is rising at an alarming rate due to isolation, stress, and anxiety from the pandemic. People are currently binge drinking more often, health problems from excessive alcohol are rising, and women are engaging in alcohol abuse more than ever. Health officials are concerned with the growing trend and how it will impact society, healthcare, and the social emotional health of the public in the coming years. The COVID-19 pandemic. The World Health Organization declared the spread of the COVID-19 virus a pandemic on March 11, 2020. The COVID-19 virus is caused by severe acute respiratory syndrome, coronavirus 2, also known as SARS. This is extremely contagious. The virus causes the infected to have symptoms like a sore throat, body aches, chills, the loss of taste and smell, cough, and in more severe cases, hospitalization and even death. Due to the virus's ability to spread through airborne particles or droplets, people were asked to stay home, practice social distancing, avoid crowds, and not get together with people outside of their homes. Governments across the globe implemented lockdowns, mandatory quarantines, and stay-at-home orders. By the end of March 2020, all states in the U.S. were under some form of mandatory stay-at-home orders. People were now working from home, schools shut down, and most businesses were closed. The world seemed to come to a sudden stop. Coping with the pandemic. While alcoholism has been a rising problem in the United States for many years, it is apparent that the pandemic has fueled this health problem. With job loss, financial difficulties, the stress of keeping families safe, and social isolation, people are looking for coping mechanisms. The psychological and emotional effects that people are experiencing during the pandemic have caused people to look to substances to help feel some form of relief from the reality of our current situation. Healthline.com states, according to the Blue Cross Blue Shield COVID-19 National Pulse Survey, overall, alcohol consumption has risen 23% since the pandemic began. This is a dramatic increase. Increased drinking. Stress, anxiety, and fear have fueled excessive drinking during the quarantine. Alcohol purchases have dramatically increased. According to the American Heart Association, alcohol sales in stores were up 54% in late March compared to that time last year, while online sales were up nearly 500% in late April. The psychological and emotional effects that people are experiencing during the pandemic have caused people to look to substances to help feel some form of relief. People have reported a higher participation in binge drinking and an increase in the number of drinks they consume in a day or week. Drinking culture on social media has set a dangerous tone for people to engage in binge drinking. Physical health problems caused by alcohol abuse. Health problems can arise from alcohol abuse and a large amount of alcohol in a person's system. Depending on the severity, they can be irreversible. Short-term effects of alcohol are dulled senses, impaired judgment, slurred speech, decreased respiratory and pulse rate, and high blood alcohol concentration. Alcohol poisoning can lead to a coma and even death. Excessive drinking can lead to obesity, heart problems, breast cancer in women, depression, and liver disease. Long-term effects of alcohol abuse can lead to significant damage to the nervous system, cardiovascular system, and can cause cancer and osteoporosis. Short and long-term effects are likely to increase. According to the World Health Organization, alcohol consumption is associated with a range of communicable and non-communicable diseases and mental health disorders, which can make a person more vulnerable to COVID-19. Beyond the increased risk to susceptibility to COVID-19, research has shown that consuming more alcohol is related, and in some cases, attributable to experiencing more alcohol attributable harms in both the short term and a long term. So some examples of short-term effects would be falls or burns. For long term, it would be developing liver cirrhosis or cancer. The long and short-term effects of alcohol abuse are more likely to develop sooner with the massive increase of drinking during the pandemic. Effects of alcohol abuse on mental health. Alcohol also affects mental health during a time when so many are suffering from various mental health issues. Alcohol abuse can worsen the symptoms of depression and anxiety. Drinking too much can make episodes of depression more frequent and severe, and are more likely to make people think about suicide. Alcohol makes antidepressants less effective and can change how the medication affects the body. With the pandemic, there has been a severe increase in alcohol and antidepressant medication being used to alleviate these issues. According to the Research Society on Alcoholism, findings demonstrating that coping motives mediated the links between greater depression symptoms, lower social connectedness, and increased alcohol consumption during the pandemic highlight the importance of these individual different factors in coping pathways to drinking. Binge drinking and solitary drinking. People have reported a higher participation in binge drinking and increase in the number of drinks they consume in a day or week. According to the American Heart Association, binge drinking is generally defined as 4 or more drinks for women and 5 or more drinks for men within a 2-hour period. Because there are people who live alone or spend a lot of time alone, there is a rise in solitary drinking. In a cross-sectional survey done on adults, the International Journal of Environmental Research and Public Health states 1/3 of participants reported binge drinking, and 7% reported extreme binge drinking. Participants who experienced COVID-19 related stress reported consuming more drinks and a greater number of days drinking. Additionally, 60% reported increased drinking, but 13% reported decreased drinking compared to pre-COVID-19. Women and alcohol during the COVID-19 pandemic. The group of people that have been highly impacted by alcohol abuse during the pandemic has been women. Women's alcohol intake has spiked since April 2020, when the pandemic was in its early stages. According to Healthline.com, researchers said heavy drinking rose 41% among women, noting that 1 of every 5 women in their survey had heavily consumed alcohol at least 1 additional day per month compared with the previous year. Women have been faced with losing their employment, having to be responsible for children and older members of their families, assisting their children through distance learning, and the stressors of having to be the main care provider during social isolation. Alcohol use is also affecting women's ability to cope with their mental health that is already being stretched thin during this global pandemic. How the media has fueled women's drinking habits. In the beginning of the pandemic, we saw social media hashtags like quarantini or pandemic juice to describe the various alcoholic beverages that people were consuming. The media has pushed the mommy wine culture of mothers actively drinking in order to cope with the demanding pressures of marriage, children, and running households. The numbers have risen in women who engage in alcohol abuse, and with the COVID-19 pandemic, these numbers are expected to rise. Women's health is being impacted by this trend dramatically. According to Elle magazine, a January 2020 study by the National Institute on Alcohol Abuse and Alcoholism found that alcohol-related deaths among women in the U.S. rose 85% between 1999 and 2017, with the largest increase among non-Hispanic white women. Stress and overwhelmed. The impact of how alcohol abuse is affecting women is becoming more apparent. A study published in JAMA Network Open in September found that from 2019 to 2020, episodes of heavy drinking among women, at least 4 drinks in one day, have increased by 41%. Isolation, increased stress, household duties, children at home, and taking care of family members are driving women to drink. In order to cope with the extra level of challenges, women are engaging in binge drinking at a staggering level. According to Elle magazine, by late June, 40% of American adults reported struggling with mental health or substance abuse, according to the Centers for Disease Control and Prevention. Women have been disproportionately impacted, taking on a greater share of parenting, teaching, and household duties, and leaving the workforce at 4 times the rate of men. Dangers of alcohol use. Although we have discussed the short and long-term effects of alcohol abuse, there are other factors that can cause harm. The chances of being injured or being hospitalized during alcohol use rises significantly. Heavy alcohol use also increases the chances of suicide. According to Health the Basics, alcohol use is also a key risk factor for suicide, playing a role in approximately 1/3 of suicides in the United States. Alcohol may increase suicide risk by increasing the intensity of depressive thoughts, lowering inhibitions to harm oneself, and interfering with the ability to assess future consequences of one's actions. Reported by the New York Times, a Centers for Disease Control study found that alcohol was found in the bloodstream of about 1 of every 3 suicide victims. Effects of alcohol abuse on society. With the rise of alcohol consumption during the pandemic, officials are concerned with the effects we will see on society. According to the COVID papers, several authors have expressed their concerns regarding various other potential alcohol-related problems. These included a possible rise in domestic violence during the pandemic, a potential increased risk of harm befalling on children, and the link between increased alcohol consumption and suicide, as well as other mental health issues. Children are being exposed and experiencing the trauma that can come from alcohol abuse in the home. Alcohol abuse and the effects on families. Some of the victims from alcohol abuse include children who may be exposed to abuse, neglect, or parents who become ill. The effects of alcohol abuse on children is detrimental. Children who live with parents or family members who drink heavily are more likely to experience anxiety, depression, fear of the unknown, among other issues with mental health. It is also unclear if alcohol abuse during the pandemic will play a role in the increase of violence and domestic abuse in the home. Common traits of children of alcoholics include isolation, approval seeking, low self esteem, fear of abandonment, victim perspective, and fear of authority. These can be issues that a child will have to deal with for the rest of their lives. The impact on our healthcare system. The COVID-19 pandemic revealed some of the systematic and critical problems within the healthcare system of the United States. The strain that the pandemic put on hospitals, doctors, nurses, and the entire medical field will be felt for years. The current trend of alcohol abuse has the potential to create another catastrophic event for our healthcare system. The COVID paper states it is imperative to acknowledge the potential impact of alcohol-related problems both during and after the pandemic so that the necessary strategies and resources can be promptly deployed. These could include precautionary measures like providing adequate and culturally responsive information on how to cope with the stress associated with the pandemic and social isolation without resorting to alcohol as a coping mechanism. It might also be necessary for healthcare institutions to be prepared for an increase in the demanding of their services due to alcohol-related problems, with the accompanying need to adapt to measures such as physical distancing and innovative ways in which these services support the population. The price we are paying. Alcohol abuse and the increase of drinking is only going to cost Americans more and more money if the problems persist. Donatel states, alcohol-related costs to American society are estimated to be well over $223.5 billion when healthcare, insurance, criminal justice, treatment, and lost productivity are considered. Alcoholism is directly or indirectly responsible for over 25% of the nation's medical expenses and lost earnings. After the COVID-19 pandemic, these numbers are likely to rise due to the increase in drinking during the stay-at-home orders. This means that American tax dollars will be going towards trying to alleviate the problem of alcohol intake. Prevention from alcohol use while at home. Now, although this is easier said than done for many, it is possible. One of the most important things you can do is to find distractions. You can exercise, there's journaling, spending time with family and friends, chewing gum, and also drinking seltzers or non-alcoholic beverages. Finding other ways to cope with the pandemic, stress, and emotions that lead you to drink is probably one of the most important things that you can do for yourself. Treatment and recovery. The first step is to detox. The process of stopping drinking and allowing your body to get rid of any alcohol that is in your system. Depending on the severity of the alcohol use, a doctor or medical professional should be made aware of this decision and should monitor this process. Another thing that you can do is seek professional treatment. Psychologists, social workers, or alcohol counselors can help people become successful to stop drinking and find strategies to cope with the feelings of wanting to drink. They can help you work through triggers and build a foundation to help you reach your goals for your sobriety. Other ways for treatment and recovery. Support groups. Finding a group of people who have the same goals or want to refrain from drinking can help people stay on the road to sobriety. A sobriety support group can help people find a connection with others who are also looking to maintain sobriety, as well as resources specific to the addiction recovery process. There are many online alternatives to in-person meetings. Alcoholics Anonymous is a 12-step program that has online group meetings to help those who are struggling. There are many different apps like Lucid and I Am Sober. These are online communities that help people keep track of their sobriety and also allows people to share their stories. Women for Sobriety is an organization that aims to connect with women who are struggling with alcohol abuse. It offers phone and online support by certified counselors to help with one-on-one support. Recommendations for public health. Health professionals and public health need to make people aware of the current increase in alcohol intake. Once the pandemic comes to an end, it will be important to see if numbers change from the current standing. The reminders of how alcohol can impact physical, mental, and emotional health may help people begin to divert their alcohol intake. Awareness needs to be brought to the communities about the effects of the increase in alcohol use and how to cope with this once the pandemic has come to an end. Very importantly, these services need to be offered to the communities that have been impacted the most by the COVID-19 pandemic. Conclusion. While alcohol has for the most part been a societal norm that is associated with happier times, the COVID-19 pandemic has forced many to reevaluate how they use and consume alcohol. For many people who are facing uncertainty, fear, and stress from the issues caused by the pandemic, alcohol has become a form of comfort and a crutch. Unfortunately, the health issues that come with alcohol abuse are substantial, and as a society, we need to plan for how this will impact us once the